Hello, this is Optimum Health For All. My name is OJ Odien.
Optimum health for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all.
Today we're going to talk again about hypertension because hypertension is so important and is so prevalent that it's something that we have to talk of again and again because it is a very common cardiovascular disorder and we need to talk about hypertension. I have brought, I have with me Professor BASDEN ONWUBERE. Professor ONWUBERE is a consultant physician, cardiologist. Not only that, he has been a past president of the Nigerian Hypertension Society. So it's in such a place that he can talk about hypertension, advise us on hypertension, and how we are going to solve the problem of hypertension in Nigeria. Professor Onwubere, you are welcome to the program.
Thank you very much, Professor Dear.
Now, Professor Onwubere, what is hypertension? For the benefit of our viewers.
Yeah, it's good. Hypertension is describes increase in blood pressure. Another name for it is high blood pressure. The pressure is the pressure needed. What the heart does in the system is to pump blood throughout the whole body. The body needs to have nutritional items supplied to the whole body to be able to function. And this is circulated when the heart pumps. There are blood vessels going around the whole body. Then the blood circulates throughout the whole body, supplying these essential needs to the tissues and to the organs. So they have to maintain a specific pressure to be able to move the blood successfully throughout the whole body. Sometimes, for some reasons, which may have been mentioned in the past, and also mention a few of them, the blood pressure, instead of remaining where it is supposed to be, goes higher than normal. And when it happens that way, it creates a problem. A lot of things can happen when the heart feels overloaded, pumping against a higher pressure instead of the normal pressure. So it gets large. If nothing is done early enough, it begins to fail, becomes weak, it dilates and becomes weak. And then say the person is in heart failure. That's the way it is.
Okay, so hypertension is very important. So we need to know about it. We need to be sure. But how do we know if we are hypertensive, for example? How will I know if I'm hypertensive?
Regularly, we have instruments for checking this blood pressure. In medical terms, we call it sphygmomanometer. It comes in different forms. And recently, for some years now, we have the automated one, which an individual can even check it. You roll it around their upper arm, and then the equipment, you press a button, and then it reads in a few seconds. It gives you your blood pressure. And most of those equipment also give you a heart rate, the rate at which the heart is beating.
So can I measure it by myself at home?
Yes, you can. That's what I'm saying. That these new equipment, they are called automated blood pressure machines. It can be anybody can use it at home on himself. But the earlier ones, the sphygmomanometer, the Atkinson's and others, you need somebody to check it for you. So somebody has to pump. You need to sit down quietly. But with the new ones, you can check it yourself.
Okay. So, but even if you don't have it, you can go somewhere to have it checked. Isn't it? Health centers,
Yes.
pharmacies, hospitals, as the case may be. Now, if it is detected that one's blood pressure is high, will they be able to have, let's say, some complaints that would suggest that they have high blood pressure?
Well, unfortunately, many people, when it rises, it doesn't give any signs or symptoms to people. That is why it is called silent killer. Because it may remain very high in individual. Only few individuals are lucky to start feeling headache that does not respond to paracetamol or the common painkillers. then you know that something else is happening.
That's happening.
Some people may have what we call giddiness. They start feeling dizzy and all that. I normally call them lucky. They are lucky because the majority will not feel anything at all. That's why it's called a silent killer. They
Until the
remain high until
complication
something
occurs.
happens and the patient may even die.
So if a patient comes to the hospital or he has decided the blood pressure is high or been detected by a doctor that the blood pressure is high, what happens next? What
So
do we
once you
do?
detect it is high, you need to see an expert. You need to see a doctor or some other healthcare personnel are being trained in the management, pharmacists and all that. They're being trained currently to be able to even identify the appropriate medication. But it's not just giving the medicine. You also need to find out, well, you don't know how long it's been high. Whether it has affected some specific organs. We call them target organs. The most affected is the heart. It can also affect the eyes. It may also affect the kidneys. It may also affect the brain as well. So these are we call them target organs.
So
So
people can
apart
have,
from controlling it, making sure you reduce the blood pressure, you also see how far these organs have been affected.
so you can do tests to find out whether
Yes.
organs have been
Sure.
damaged or not.
No,
So, but the idea is not to get to that stage
no.
of organ damage. Now, if one's blood pressure is high, there are medications that will control it, isn't it?
Sure.
But before medications, or even with medication, are there any other thing that the patient can do or somebody can do to make sure that the blood pressure does not remain sustained that high fashion?
Yes, apart from the medical expert giving you the appropriate drug, there are also what we call risk factors that you need to control. You need to do lifestyle modification. There are certain things that promote high blood pressure increase. If you are not doing exercise regularly, if you allow yourself to become fat, become obese, and other things. Also check if you have diabetes or some other related things that make the management a bit more difficult.
Okay.
Those things need to be identified.
What of alcohol, cigarette smoking?
Yes,
things like
they are also major risk factors for that. But cigarette smoking has no benefit. There's no benefit at all. It's a habit that you can't understand. So when somebody is smoking, you advise them to stop smoking, not reduce smoking. But for alcohol, we advise people to do it to moderation. If you are feeling stressed or something, you take a little bit, a glass of alcohol. It shouldn't do you any harm. It may elevate your mood.
Okay, so for both alcohol, we reduce it to the barest minimum. Usually, for women, one drink, standard drink a
Yeah.
day, and for men, two standard drinks a day is regarded as moderate alcohol intake. And we've discussed alcohol before on this, so you can refer to the past videos where we've discussed alcohol and what is a standard drink, and for men, and what is the good for women. That is one standard drink for women, two standard drinks for men a day at moderate alcohol intake. Now, let us go to other things. Lifestyle modification you have mentioned. We talk about drugs. We know that there are drugs available for the control of blood pressure, but these drugs have to be taken regularly. Now, there's usually a problem when these drugs are there, they are expensive, sometimes not readily available, so that um, compliance, that is trying to taking the drugs regularly, becomes a problem because adherence problems. So what do we do to ensure that the prices of drugs are reduced? For example, what can government do? What can insurance companies do? And also to ensure that these drugs are made available for patients to use.
Well, to make them available, what you are talking about has become worse in the past few years in our country. We're in Nigeria. So everything we're talking about refers to Nigerians. I think the government has a lot to do. The government has a lot to make sure the prices of items. Some of the companies that market some of these drugs have left the country. And each one that leaves, their drugs become 10 times the price because you now depend on imported ones. So I think the government has a lot to do. Ordinarily, people complain that the government is not sensitive enough for health and education. And health It's standard. You need to be healthy to do anything, to perform any function, even for the government. So I think the government has a lot to do to regulate, to make sure the prices of items.
Okay, like reduce import duty on
Yes,
drugs, for
yeah,
example,
sure.
and medicaments.
That's
Also, to ensure that this comprehensive health insurance scheme becomes widely operational. Majority of people can benefit from it.
It's an important aspect of it. In most countries, even the developed countries, people are able to get this in through the health insurance schemes in the UK and the US and other countries. So the government I don't think it's up to 10, 15 or 20% of Nigerians that are currently benefiting from the health insurance. You can't, even if you travel to US or UK, you cannot afford that unless you're on the insurance. Honestly, individuals don't pay. Out of pocket expenditure in Nigeria is very high.
And it's crippling.
Yes.
So, thank you, Prof. I think this is some of the. You have any general word of advice to our patients or for the general public who may find their blood pressure as elevated?
Well, if your blood pressure is checked and you find it high, do not panic. Blood pressure behaves funny. It responds to the state of your mind. If you're upset and you're worried about something and you check your blood pressure, you'll be surprised what the difference will be when you've relaxed. In fact, ordinarily, blood pressures are lowest in the night. So we have equipment for checking blood pressure for 24 hours.
Yes.
Person checks it and he records it. You find that in the night, you can have very low blood pressure because you are sleeping and your mind is off. But in the day, with all the stress gradually increasing in our country now, so blood pressures are very high, especially in the waking hours of the morning. So we advise people don't check your blood pressure as you are waking up because it's for everybody. Whether if your blood pressure is even high or not, it's highest in the waking up. Because a lot of things happen physiologically when you are waking up. It's not just that opening your eyes from closing your eyes. No, it goes beyond that.
Okay, so that may be one of the reasons why people have some difficulties in early hours of the morning.
Sure.
Some people have maybe they sleep and they find it they don't wake up because there has been some compromise, maybe some stroke in the night, or they've had heart problems because the blood pressure surges. Usually early in the morning.
Usually early in the morning. Most of such things happen early in the morning. So you didn't wake up. Even if you maybe a couple, your wife is there with you. If it happened in the night, people will know it happened in the 1 a.m., 2 a.m. But no, most of them happen
in the morning.
Maybe the wife or the partner may even have woken up before this happened. When you come back to say, why hasn't this person joined us in our morning prayers or whatever? You find that you cannot even wake up.
So thank you, Prof. Thank you very much. Thank you very much for answering an invitation. And I know that you are a very busy person, but we are glad that you were able to make it and be here with us. Viewers, this is Optimum Health for All. Thank you for viewing. Please subscribe and like and share these videos as widely as possible for the benefit of all. Thank you. Bye for now.
Optimum Health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the mission, got the vision on deck. Cut the stress, no mess, keep the wellness in check. We thrive, we shine with every routine. Optimum Health, you know, but Optimum Health for all.